Good morning, everyone. Thank you very much for this opportunity. Dear college, although rarely studied together, public health and political science shares important connections. This presentation explores how democratic systems can improve quality of life through health policies, and how a healthy population can, in turn, strengthen democracy. It focuses on five key dimensions: equal access to health service, informed citizens' participation, collective health policymaking, the role of education, and preventing social exclusion. This presentation too explores the profound and often overlooked relationship between health and democracy. This connection is based on the premise that both individual and collective well-being are. Here we present five core dimensions in these relationships. We can think in going on the work of Henri Giroux. We can emphasize that democracy should not be reduced to electoral process or institutional frameworks. It is also a cultural and practice. Education plays a fundamental role in developing critical citizens capable of questioning, interacting, and actively transforming their realities, their societies. Therefore, schools must go beyond instruction to become a space that fosters justice, equality, and participation. Zero also criticizes neoliberalism for commodifying education, weakening democratic values, advocating instead for a robust, policy-funded education system that serves the common good and prepares young people as agents of change. From a public health perspective, democracy encourages the design of inclusive policies that guarantee access to essential services such as health care, clean water, and nutritious food. In democratic systems, citizen pressures can generate beneficial programs such as school feeding initiatives and urban planning that promote physical activity. Therefore, health is framed not only as a personal responsibility but as a social right supported by state actions. A healthy population is better prepared to participate in democratic life. Physical and mental well-being enable citizens to vote, mobilize, debate, and hold governments accountable. This reinforces the idea that health underpins for citizenship and democratic participation. Furthermore, democratic society encourages decision-making on health-related matters. Citizens play a key role in shaping public health policies such as good food regulation and environmental standards. The examples of Brazil and South Korea illustrate how citizens' initiatives can influence policies that promote healthier environments. Education and freedom of expression are vital to disseminating accurate health information. Democracy allows the free flow of knowledge about nutrition, disease prevention, and exercise, empowering people to make informed decisions. In contrast, authoritarian regimes often restrict access to such information, limiting autonomy and violating rights to health. Health inequality reflects deeper deficiencies in democratic representation and social justice. When entire population lack access to basic health resources, this manifests exclusion and weakening of democratic system. Promoting health, therefore, becomes a form of resistance to authoritarianism, stressing both inclusion and civic responsibility. Health, living, and democracy are interdependent. Democracy underpins the structural condition for health, while health facilities meaningful civic participation. Together, they form the foundation of a just, inclusive, and resilient society. Sorry for my English. Thank you very much for your attention. Thank you very much.